you are eligible for Medicare, there is some important information that you need to be aware of. Dr. James Burrell with the Cigna Medical Group is here to give us all of the details that we need to know for, if not ourselves, then maybe some of our loved ones that maybe need a little help along the way trying to figure out how this all works best for them. Nice to have you on the show.
A pleasure to be here.
So Medicare's annual enrollment period is going to end on December 7th, is that correct? Which, if I'm not mistaken, is a little bit earlier than in years past.
That's correct. It opened on October 15th and runs through December 7th. Then whatever plan you've chosen, you're locked into it, and the actual plan becomes active on January the 1st for 2012.
Okay, so this topic tends to be so confusing for so many people. When you talk about the plan that you're considering and dealing with that deadline, what should they consider specifically as it relates to, say, the Medicare Advantage plan and how that would compare to the other plans that are available to them?
Yeah, the Medicare Advantage plan is certainly a premier way of looking at your Medicare needs being met. There are fee-for-service or standard Medicare options. The Medicare Advantage plan just has a lot more features that improve your health, keep you well, have a lot of preventive programs.
Now, tell me about this rating system that basically allows us to have a little bit more insight into how that plan would really work for us.
Yeah, Medicare has done a detailed analysis of all the Medicare Advantage plans throughout the United States. They do it every year, and they rate them on a star rating 1 through 5. They look at about 50 different grade points for the plan. Things like the quality of care received, member satisfaction, customer service, what preventive and wellness services they provide, and then they rank them 1 through 5, with 5 being the highest. And they do that because it's such a complex issue. It'd be hard for a regular citizen to really look at that, for a senior to know which plan to choose. So Medicare does some of the research for you in a way.
So the Medicare Advantage plan, what was the rating for that program?
For the Cigna Medicare Advantage plan, it was 4.5.
Oh, out of 5.
Out of 5, so we were very pleased with our rating. And
why do you think it scored so high?
There are a variety of features that we really work on quite diligently. Our preventive programs, our wellness programs, our patient education programs, and then we're attached into Cigna Medical Group, which is a group of 225 clinicians here in the Valley and 23 different primary care clinic locations that are quite focused on our Medicare Advantage plan members. So we try to integrate their care.
What I'm understanding, and please correct me if I'm wrong, that this Cigna Medicare Advantage really seems like it's going to open us up to a broader spectrum of care, just at the basic level of the way that plan operates, just merely because it's married with Cigna, who has all those clinicians that you talked about. Is that kind of accurate?
Yeah, there certainly are services that are available in a Medicare Advantage plan that aren't for typical fee-for-service Medicare. Patient education programs, for example. We have diabetic education classes, general health education, nutritionist, things of that nature that you wouldn't normally see if you were a fee-for-service Medicare member.
What should people, as they sit and look at this, I mean, we are, a little bit less than a month before the deadline, a lot of stuff to go through. It can be very overwhelming. Insurance in any fashion can be. What are some of the key things that viewers should be trying to compare when they're looking at the plan that's going to suit their needs best?
Yeah, it is a complex situation. I'm over 65 myself, so I get flooded in the fall with all sorts of brochures, marketing information from various Medicare Advantage plans, and that's where using the star rating is of benefit, where Medicare has done quite a bit of the analysis for you on things like customer satisfaction, customer service, quality of care. But then the other features to look at are things like affordability and whether the plan is customizable to your needs. The Cigna plan, for example, has 2 components, either a 0 monthly premium plan where you pay copay and deductibles as you encounter your physician or hospital, and our premier plan, in which There is a modest monthly premium, but the copays and deductibles are less. So looking at affordability and how is it customizable to your needs.
Well, it looks like we've also got,
features.
the prescription coverage that we need to be aware of, the access to the physicians and clinicians that you had talked about, and all of those extras that do add up. We're going to have you stick around throughout the hour because this is just a really complex situation that we want people to feel really good grasp of understanding by the end of the hour. So stick around, I'll grab you a cup of coffee or maybe some water, and then we'll take some questions from our viewers. Perhaps Cigna holds free seminars, in fact, in-home meetings all over the Valley, and you can choose the plan that is right for you with their help. You can register for any of those by calling 800-845-3819 or by visiting CignaMedicare.com. For information about Cigna Medicare services, you can call 800-845-3819. Representatives are available right now to answer your questions. And you can also visit CignaMedicare.com. You can also find general information about Medicare plans by calling 800-MEDICARE or visiting Medicare.gov. A lot of information, but we have just scratched the surface. So here's the deal. We're going to have him stick around for the rest of the hour to answer some Medicare questions. So head over to SonoranLiving.com, click on that House Calls button that you see right there, submit your question, and we will answer it live right here on the air.